Hello, my name is Jane Cordell. I became deaf aged 25. I use English language and lip read. Thank you for watching this video. Richard, what happened with your head? Painful? Would you like an opportunity to work together with health managers to improve access for deaf people? This video will explain a project by Salford Integrated Care Partnership to work with people in Salford who are deaf. They want to improve access for deaf people so that it is fair and equal. This video is in 5 parts. First, who is the Salford Integrated Care Partnership and what do they do? Second, what have deaf people told Salford Integrated Care Partnership they need? Third, what improvements and changes has Salford Integrated Care Partnership made for deaf people? Fourth, how will the project work? Fifth, how can you join in? First, who is the Salford Integrated Care Partnership? What do they do? Salford Integrated Care Partnership is new. It's part of the NHS Greater Manchester, which has representatives from the NHS and from Greater Manchester's 10 councils. It decides how to use Greater Manchester NHS money and how to provide the best services. Greater Manchester is large. It has 10 boroughs. NHS Greater Manchester has one plan for the whole of Greater Manchester. The plan covers all health services, hospitals, GPs, community and voluntary services. It encourages all these to work together to help everyone live well in Greater Manchester. Second, what have deaf people told the Salford Integrated Care Partnership they need? Deaf people in Salford have told Salford Integrated Care Partnership that the 2 most important things to them about health and social care services are 1, getting the same access as hearing people, 2, being able to access the services independently. Salford Integrated Care Partnership understands that to achieve this, deaf people need 5 things. First, accessible information. Second, staff who are deaf aware. Third, accessible communication so they know when it's their turn in the waiting room. Fourth, easy and quick access to BSL interpreters or other communication support workers for appointments with your GP or hospital outpatient, day patient appointments. You also need to feel sure that BSL interpreters or other communication support will be available if they are staying in hospital as an inpatient. 5. Reliable loop systems in healthcare buildings, which staff understand how to operate and which work. In 2016, the NHS created the Accessible Information Standard. Salford incorporated the Accessible Information Standard into its own system for checking the standard of work at GP practices. Third, what improvements and changes has Salford Integrated Care Partnership made for deaf people? Salford Integrated Care Partnership listened to what deaf people in Salford told them. They have made 4 changes. First, if you are a BSL user, you can use Sign Live to contact your GP or to use an interpreter online for a GP appointment. If you prefer to book directly online, most GPs offer this too. Second, many GP practice staff have received deaf awareness training. Third, Salford has funded projects to help GP practices understand loop systems and how to maintain them properly. Fourth, you can send feedback or a complaint to Salford Patient Services using email. You can also upload a BSL film of your comments to Health Watch Salford's website or WhatsApp address. There is some progress, but Salford Integrated Care Partnership knows it needs to do more. This is why Salford is setting up this project to work together with you and other local deaf people. Fourth, how will this project work? Salford locality wants to work together with you, local deaf health service users, to do 2 things. First, to agree priorities. Second, to agree with health managers how and when changes will be made. The project is in 3 stages. First, there will be 2 questions for you at the end of this film. You can send your answers using accessible methods. We will then study your answers and do a summary for Salford health managers. Second, there will be a workshop face-to-face on Thursday, May the 25th, with full communication support, including BSL interpreters, lip speakers, and note takers. We will facilitate the workshop. The workshop time will be 12:30 to 3:30 in the afternoon. It will start with some lunch. You will meet Salford health managers to discuss practical solutions to improve things. You will also receive a voucher as a thank you for your time. We will summarise the most important messages from the workshop and share it with the whole of Greater Manchester. Here are the 2 questions for you. Number 1, what positive change do you want to happen in Salford healthcare? Number 2, how can Salford healthcare make this happen? What do you recommend? You can send your reply as a short video or text message on WhatsApp. Or you can email diane.critchley@nhs.net. Here's the information. Finally, fifth, how can you join in? We have 12 places in the workshop on the 25th of May. If you are interested in taking part in the workshop, please contact us by video or text message on WhatsApp or email diane.critchley@nhs.net. You can also use these contact details to ask any questions. Thank you very much for watching this video. We hope to receive your ideas and to meet you on the 25th of May.